Good afternoon, and thank you for joining us for today's webinar, Keeping Older Americans and People with Disabilities Safe and Healthy in Emergencies. My name is Rachel Logan, the Training and Technical Assistance Manager at the National Center for Health and the Aging. Today we have the pleasure of having Kathleen Oti from the Administration for Community Living. She is the Regional Administrator. Kathleen has served as the Tri-Regional Administrator for the U.S. Administration for Community Living. In this capacity, Kathleen is responsible for implementing the Older Americans Act within the 14 states and 2 territories she serves. Prior to her work with ACL, Kathleen served as the Director of Elderly and Adult Services for the state of New Hampshire, as well as the Administrator for Assisted Living and Nursing Facilities in New Hampshire and Oklahoma. She holds a bachelor's degree in social work and a master's degree in organizational development from the University of Oklahoma. In various leadership roles, Kathleen has planned and implemented emergency services for seniors living in both community and facility-based environments. Most recently, she has worked with federal, state, and local officials to identify best practices and lessons learned following Hurricane Sandy. After today's webinar, attendees will be able to discuss the value of fostering partnerships to keep older people safe in emergencies, identify the building blocks of disaster preparedness and planning for older Americans, including useful tools and checklists, and summarize best practices learned from Hurricane Sandy when serving older adults. The main objectives of the National Center for Health and the Aging are to work with national and state agencies, help health centers conduct needs assessments, and better serve their populations. We also offer training and technical assistance that is free to all HRSA grantees. When you are planning some of your community and emergency preparedness activities, it is important to consider certain factors. Some of the factors include 70% of adults aged 85 and older living in traditional community settings, as well as the majority of the older adult population having at least one chronic condition. Also, older adults suffer from physiological, sensory, and cognitive changes that may cause them to be special needs patients during emergencies. Older adults also are underserved when it comes to emergency preparedness programs and services. I would like to remind all the attendees that today's webinar will be recorded and made available to you on our website, as well as all the registrants will receive an email with the PowerPoint and the video attached. I'm going to go ahead and pass the webinar over to Ms. Oti.
Very good. Thank you, Rachel, and I would like to thank everyone for coming to the webinar today. Again, we wanted to come and talk a little bit about the federal perspective of older persons with disabilities and how to keep them safe in emergencies. I feel as if I have some stories to share with you, and certainly nothing that is earth-shaking or new and innovative, really some keen reminders of what it takes to keep all of us focused on prevention and also how to react with this specific population when disasters and emergencies present themselves. So again, I appreciate your time and your attention today as we speak a little bit about how to keep safe during disasters. So let me share with you, first of all, a little bit about my experience. I have had professional as well as personal practice with many emergencies that relate to seniors and people with disabilities. As a nursing home administrator, I actually went through 2 fires and also water pipe breakage that caused evacuations of our seniors. Also in Oklahoma, we have many examples of preparedness when we deal with tornadoes, and now that I live on the East Coast, certainly hurricanes, power outages, and ice storms. I've had the opportunity to serve both in a federal level as well as a state person who will respond to various emergencies and also deal with some of the challenging aspects of this particular population. I wanted to say that you may not know the Administration for Community Living. With its new name, we actually changed from the Administration on Aging, incorporating people with disabilities into our administration last year. And that was an opportunity for all of us to learn a little bit about the disability population. Hurricane Sandy hit about 3 months after our new administration took place. The Administration for Community Living is here to serve those people over the age of 60 years of age to provide support and be a visible advocate for our seniors. But probably the most important piece about our administration is our aging network, and I will refer to that today in our presentation. The aging network that we have through our state governments and into area agencies on aging and providers really are a resource for you, and many of you, I'm certain, know of area agencies on aging and our ADRCs, which are Aging and Disability Resource Centers. If not, I'm going to urge you at the conclusion of this webinar to make sure you investigate what your state offers and utilizing the expertise and the resources within those valuable resources. So the theme of today's session really is to resolve to be ready in 2014, making sure that there's a personal commitment that you make, because all of us know people who have some disabilities or those people who are older living in the community that you can help either professionally or even personally. At this point, I want to talk a little bit about the current United States population and the health realities. As you can see on the screen, and as we covered just a little bit ago with Rachel, many people are choosing to remain at home, but they have chronic health conditions that increase their vulnerability. Many of them require substantial health care services to keep them independent and to keep them vital. And of course, as you know, many people require 4 to 8 prescriptions or over-the-counter drugs on a daily basis. And this certainly is something that we need to make mention of when we begin to talk about emergencies and disaster. We have more people living over the age of 60 today than we ever have, and that is growing expeditiously. We also have people who live in rural settings that we may not know about. These could be the invisible populations, people who live out in the country in rural areas of our states that may not receive home-delivered meals, may not attend a senior center, and they don't actually receive services through a state entity, so they may be somewhat invisible. We also know that this generation, different from other generations, has an increase in alcohol and substance abuse, and this is certainly something that needs to be taken into consideration whenever we're dealing with this population and looking at the specifics of disasters. And I think also another thing to make mention about is that the senior of today, and we'll talk about this a little bit more, is really one that takes control of their life. They prefer to make their own decisions, and as compared to the generations of yesteryear, so talking about maybe some of the greatest generation population, we can see that this particular population of seniors that we have, 60 and above, really prefer to make their own decisions, and indeed this can be a critical conjuncture whenever you have a disability facing you and you're asking someone to leave their residence and they're choosing not to do so. So where and how older adults live in the United States continues to change, and I made mention that people are choosing to live in their communities versus leaving nursing facilities. I think this also is something that, as we talk about this population, we need to think about also those people who are isolated or lonely. They're living at home. They may or may not have family members that are close by. They may or may not have a caregiver, but we know that that they have special needs and that they do require support many times to remain in the community as functioning in a vital way. Also, we know, as the experience of Hurricane Sandy showed us, that many people who live in high-rises in some of the rural areas have not been receiving services, and so therefore we didn't know about them. And I'll talk a little more as we speak about some of the experiences with Hurricane Sandy. But these people tend to, we tend to see more and more people turning 65, being independent in the community, which is their choice and their place of reference. And as we know with some of the advertisements we see, I'm thinking back last year to the Super Bowl when we saw Betty White and Abe Vigoda, we know this population is very spirited, and we know that indeed they choose to live where they'd like, and they prefer services of their choosing. We also know disasters happen everywhere, and just this morning there was an earthquake in Puerto Rico that was 4.6 on the Richter scale. Even over the weekend we had West Virginia with the water contamination issue. So I would say to all of you that are attending this webinar that have a healthcare background and deal with this population as it relates to emergencies, take a good look at your environment, your geographical area. Are there ammonia plants, say for example, in the rural areas that you live in? Do you recognize that that could be a potential threat? An ammonia cloud could be released and all of a sudden your aging population would be at risk. Power outages, again, another thing that would really that is an all hazard that affects all of the folks in many of the areas. Also dams in the state of Virginia. We have a couple of dams that are on a watch list because they have been shown not to be as strong as they once were. So you need to take a good look at your geographical area. And then also, once an event has occurred, take that time to do a lessons learned approach. For example, and I will use an example of friends in Alabama, the area agencies on aging that I referenced when I first began speaking, noticed a couple of things with 2 or 3 tornadoes. They noticed they had an increased demand for hearing aids, for dentures, and walkers. So when you begin to think about disasters and where they occur, think about your geographical area and what specific is a threat to you and those people that you serve. I also make mention of something that I think is also vitally interesting, and that is behavioral health. Behavioral health is one of those things that we know is there, but the support from the federal government has been most helpful when we've had some of the significant disasters of late. Behavioral health, as it relates to seniors, is so important. Reassurance, help for information and resources, and also to serve as a support of someone just to talk to with the frustration. But behavioral health plays a large role in this population. I also want to just take a moment to talk about the Aging Network and how the functions of the Aging Network assist those people who are older in the event of a disaster. On the federal level, whenever there is any type of a disaster, our ACL headquarters works with regional offices to help get information and to share information with the Assistant Secretary on Aging, which is Kathy Greenlee, for those of you that do not know her. Kathy Greenlee works within the emergency planning process to ensure that the needs of older people are being met, and she relies upon that information and gets that information through the state agencies on aging, as well as the tribal organizations that are throughout our United States. The ADRCs, the Aging and Disability Resource Centers that I made mention of, are vital for being a one-stop shop for seniors and their caregivers to get valuable information on emergency preparedness, information as well as in the event of a disaster, where are those resources? Supportive services and volunteers. If a senior is receiving information from and services from a state, is on a waiver program, or is receiving home-delivered meals, then again, we know about them. But many times we do not, and that's one of the things as we talk about the essential partnerships and collaboration. As a healthcare provider, what is most of interest is that you need to know your community. And it does take a village where you begin to interact and have communication with some of the vital partners that play a role in recovery and resiliency. And as you can see on this screen, the other essential community partners are listed, all of which have a specialty. But coming together and planning for any type of a disaster is most helpful, and to know about them ahead of any type of disaster. I would also urge and recommend that people who deal with disasters, and especially populations of elderly people and people with disability, that you, in peacetime or when it's before the disaster, that you establish these relationships with people so that you know who to call upon in the event. But know, too, that the Aging Network is vital. The Aging and Disability Resource Centers and the area agencies on aging are there as a resource for you in the event of a disaster. And they many times have been working with some of your clients to help them understand that they need to provide and to complete checklists prior to an event. So we spoke about the essential building blocks of older adult and disaster preparedness planning, and one of the things that I'd like to make mention as you look upon your screen is that of caregivers. Caregivers truly are an essential part of what we know to be an essential building block. Caregiver can be an informal caregiver, or it could be a paid caregiver, but we really need to promote preparedness within those people who support seniors and keep them at home. We know also that pets, people who are older love their pets and they choose not to travel or to go places without their pets, choose to remain in situations many times at their detriment because they don't want to plan. And caregivers can make a valuable role. The senior would be able to trust a caregiver in the event there was a disaster. So I would really not rule that out as a very important individual that seniors and people with disabilities need to include in their preparation and planning for an emergency. Also, establishing and fostering a community and a regional partnership. I think, again, the practice is following an emergency to be able to go back and to review some of the things that went well, certainly some of the things that you would have done differently or better, but all of this practice really helps to build the disaster foundation in response to any type of a disaster, whether it be a hurricane with significant power outages and damage, or to even ice storms and water contamination. Again, planning and knowing what's in your environment is helpful. I would also say, as we talk about engaging the community and fostering and establishing partnerships, I would encourage all of you that deal with this population to reach out to your community partners, identify them, and definitely include them in conversations with not only individuals but also your staff members. Again, talking about supporting and participating in preparedness planning, preparedness training is really power. And I would include your federal and your state partners in any kind of training that you can in your local communities. That people love to be able to come in, share information, provide some of the collaterals that they have, and really talk a little bit about what support is needed during a response to some type of an emergency situation. The staff can play a critical role in that, and if you train and practice and revisit this on a regular and ongoing basis, they will really feel more comfortable when responding to an emergency. I just want to pause for a moment and share a personal story. As I made mention, an assisted living facility that I was the executive director for suffered 2 pipe breakages during the cold weather winter in New Hampshire. My staff had trained considerably for this opportunity to what do we do if we need to evacuate. The state code required that we evacuate in less than 9 minutes, and this was a 3-story assisted living facility with 100 seniors living in the residence. The staff had practiced that when we actually had an event, and we had them 2 years apart, they were able to not only get them out in a 9-minute time frame, but they really knew what to do. They knew who needed the additional help and assistance, and they felt confident. This also is good for your residents and for people that you provide care for in a setting, that when you're prepared and your staff is trained, you feel confident to respond. Individual preparedness, which of course is so important. I would also say to all of us, we all have a profession that we want to be prepared for, but we also have a personal life that we too need to plan and prepare for. If you would take the information that we talk about today and some of the resources as part of a checklist or even some of the tools available online, make sure you share that information with people that you know may need additional assistance in the event of some type of a disaster. But we know social media and tools such as the media are resources for us. Many of our seniors, as it relates to Hurricane Sandy, saw the opportunity to prepare because they had the advance warning via their telephones and also on Facebook, where there would be a banner at the bottom if you lived in a particular area. These are resources that our seniors of today are using much more readily than they have in the past. But again, you need to know about them and make sure that you have shared this information with the clients that you serve. I would also say emergency preparedness checklists and fact sheets. At the end of this presentation, there's a plethora of information that I hope you will take the time to look at, because it definitely provides reminders that we all need to be prepared in our homes, as well as for those people who need special assistance in the middle of a disaster. And then also the disaster hotline, as I made mention, one of the things that we recognize, whether it be any kind of a disaster or even a man-made disaster, such as sometimes some of the unfortunate shootings that we've had, behavioral health becomes a key player in this, and SAMHSA, who is our federal partner, provides a distress hotline that is used extensively in disasters of all sorts and nature. And I encourage you to make note of that, so that if indeed you have a situation that takes place in your area, that you contact your federal partners for help and assistance, because the disaster hotline comes in very, very handy and is so needed and essential for those people who are dealing with various types of challenges in their lives. Facility preparedness. Again, relying upon some of the same resources that we spoke about with social media. But I think also it's really an opportunity for facilities to understand about their own requirements for shelter in place, and also whether or not they need to evacuate. If they indeed evacuate and have an evacuation plan, it needs to be practiced. But again, I think the confidence that a staff will gain in the practice of these events cannot be understated. Ombudsmen, I think we have many ombudsmen who may be taking part in today's session. You play a vital role, as many times when you visit a facility, you can be that voice that notices whether or not snow has been kept from the exit areas, or maybe the administrator hasn't noticed something is in need of repair. It's up to you to be able to come forward as a partner to help the administrator with that type of an observation, so that you can keep your older adults and people with disabilities safe. Communication is just truly one of the things that I think we need to continuously bring forward as an awareness. Certainly, I think establishing the partners and the network, but also talking and sitting down and having discussions and roundtables about how best to be prepared. What are the best practices? And are there any new widgets or any new resources available that either for a purchase or for even a practice you can utilize in your own planning? I would also say, as it relates to the facility preparedness, there is state government has done a great job with our EF6 and EF8 partnerships that we have in response to disasters. We see many more, disasters such as power outages. Utilize the information through your ESF and ESF8 state planning tools. Again, you can only really do as much as you can and locally, but your federal partners are there to help, and your state governments will certainly enlist their expertise as well. And community preparedness, which I think is really where I wanted to focus upon today. The opportunity for us to be able to begin speaking and also encouraging people on a regular basis to consider preparedness for people who might need extra help and consideration is critical. Senior expos are one way to do that, and I would encourage the healthcare coalitions to consider this. Bringing people together, talking about their individual health plans and their disaster plans, making sure that you have people at expos that can provide information to seniors and their caregivers, as well as people with disabilities, so that they feel confident. Regional agreements, I think, are a great thing to do, but I would also encourage regional agreements to be reviewed periodically. Another example that we saw in our Sandy experience, many of our facilities, our nursing facilities, had transfer agreements with other facilities. In Hurricane Irene, this was especially significant, as many people saw. New York actually transported people out of nursing facilities and hospitals in preparation for this storm. The storm actually was not as significant as Hurricane Sandy, but what we learned from that experience is that nursing facilities had transfer agreements that didn't work. In other words, if I had a transfer agreement with nursing facility A, when it came time for me to move my residents in my facility, which was Facility B, maybe Facility A had already taken on additional people from their local senior center or perhaps a hospital, so there was no room for my residents. We found that to be the case, and that's why I encourage all of you who have regional agreements to make sure you share information and have contingency plans for those as well. Make sure you integrate the community assets and promote a whole of community incident command and structure. Again, meeting in peacetime and talking about it, including your state government, their resources within the area agencies on aging. Be very proactive as you utilize those resources and share information. Also, communication. I think developing a communication plan so that the community is prepared is helpful. As an example of how to have the need for a communication plan, many times seniors with a power outage will bring in generators into their homes, or they will bring in electric heaters that can produce carbon monoxide. Having a good communication system, so if you know where those transparent seniors are and you know where people are that are vulnerable in the community, you can get information to them. And sometimes the robocalls are very, very good, but having some system that you can identify to share information to prepare this population for disasters and keep them apprised of what is occurring is very, very helpful. So again, talking a little bit more about some of the community preparedness. I think identifying legal options, making sure people have their checklists and their power of attorneys, they have their information that is in print form, such as phone numbers and contact information for family members. Those are important because in this day and time we tend to utilize our cell phones to be our old Rolodex, if you will, and it's good to have a printed version of information such as the legal options that you have available in a safe and secure place. I also would recommend, as everyone knows, to have go bags and things in the community. This is part of the expo that I shared with you. I think if you can get information out about that, helpful information ahead of time and utilizing social tools and resources, you will find that your plan is really very, very close to being helpful in the event of a disaster. So one of the things that I thought we would do, just in closing summary, I wanted to just kind of revisit how some people can be transparent and invisible in the community. Many states, and this is where I think it's critical to share good practices and best information. Example is using Alabama again with many of the tornadoes that they had. They chose to bring together nonprofit entities, to bring them together into what's called a volunteer organization. So in the event there was some type of an event, whether it be a tornado or even a hurricane, that those volunteers would know what to do and where to go. In the state of New York, when we had Hurricane Sandy hit, news was covering that we had people who were in high-rises with no water, no running water, their pets had not been walked, and they had no medication, or they did not have enough meals to sustain them for the week that they were without power. That was vital and information because it just really turned up people who wanted to help. Volunteers came from all over the world to New York so that they could be runners to run up, down 38 flights of stairs to help seniors who had needs. However, what we found is that we really hadn't a plan in place to coordinate volunteer efforts. Alabama has, through their nonprofit entities, they have a coordinated effort so that they train people on what to do, where to go in the event of any kind of disaster. And again, this just really helps coordinate your efforts to serve their needs in the event of a disaster. Again, I think also the caregiving arrangements, if a state it has clients on their clients that are receiving state services, many times there are contingency plans and they know that they have caregiver plans. But it's good for us to be able to make sure that older adults and people with disability have those written down and have practiced them. And again, the whole community approach, recognizing the value of relationships and networking. Following Hurricane Sandy, I think we still see, even to this day, some of the challenges that we really have not been able to find a complete solution for. Many of our seniors chose to remain in their homes, and many of them remain there still, with many repairs still needing to be completed on their home. We found that people who lived in this area along the shoreline did not have insurance because they could not afford it. And now they find themselves in a situation where the repairs need to be made, and yet the codes have been changed. So being aware and having a community that comes together, that doesn't forget this population, that brings people together and talks about what we can do to assist these people is really helpful. The community approach forgets not those people who are invisible and have special needs after the event. And as I say, as we go forward and plan and talk about the community approach, it truly is talking and planning and recognizing the relationship that exists within your community. I've added several pieces of information that I just want to briefly talk about. A checklist or a commonplace and a common tool that's readily available and available through all of your federal partners, such as CDC, such as SAMHSA, such as the Administration for Community Living. I think, again, what my recommendation would be, if you have not done so, is when all of you are in the community, have those checklists available and have the conversation to speak with seniors about whether or not they're going to plan to shelter in place, or if they're interested in evacuation in the event of an emergency. Start the conversation and keep it moving periodically throughout the year so that you are ready to go if indeed a disaster strikes. The information and the resources that we've added, in addition to the checklist, are areas such as widgets, pamphlets, training that is available, and again, through the course of the PowerPoint presentation that we have for you, these are available and you can utilize as an active link whenever you need them to plan your programming. And just in conclusion, what I would encourage all of us to do, and as I say on a personal and professional note, is to be ready and resolve to be ready in 2014. I think as an individual and as family members, it's easy just to brush off the need and the requirement for this until you have something happen in your community. We're always reminded of the serious nature of this, if people who die in their homes because they were either not known or we couldn't get to them. So pre-planning is definitely the key. I really appreciate your time today, and also would like to thank the folks at HRSA for allowing this opportunity to come together and to share some of the observations that we have. So pending questions from you, I'd like to conclude my part of the presentation, and Rachel, come back to you.
Okay, thank you so much, Kathleen, for the energetic and very informative webinar presentation. We will now open up the Q&A session. If you would like to ask the presenter a question, please submit it through the questions box on your control panel. In the meantime, while I'm waiting for some questions to generate in the queue, I'll just have some brief announcements. These are additional resources. Although Kathleen did add some resources to her PowerPoint presentation, these are some ones that we recommend, and you can check both of them out. You really can never be too prepared or have enough information about emergency preparedness, especially when it comes to assisting older adults. Please feel free to visit our website at helpintheaging.org. We have webinars, archived webinars on there, monographs, other free forms of resources and training, as well as other and additional technical assistance. If you are interested in joining our mailing list, here are some of the things that you're able to sign up for and receive. Also, I would like to announce the National Primary Care Symposium on Aging, which is going to be June 9th in Alexandria, Virginia, at the Westin Alexandria. Our theme for this year is Cornerstones for Improving Senior Health Outcomes, Outreach, Enrollment, and Community Partnerships. In order to register or for more information about this year's symposium, please click the link that is attached. We also have a Twitter account, and we do update our Twitter fairly regularly. We tweet information about resources, upcoming events, and information. So please follow us on Twitter, become our friend, correspond with us. We would love to have you. Also, subscribe to our YouTube channel, which houses a lot of our archived webinars. So we have a lot of free information on there as well. If you need any other form of training and technical assistance, please feel free to contact anyone you see here directly, or you can call our phone lines, our direct phone lines, at the number you see below. We do now have some questions. Once again, I do want to thank you, Kathleen. We may need to get you to come to our Aging Symposium because we kind of overbooked for this session. It was just so many people who wanted to be on the call. And I will remind all the participants that the audio and the webinar will be available directly after this session. We'll send it out via email and also post it to our website for future reference. One person asked, the presenter mentioned that the repairs had to be made after a natural disaster, but the codes had changed. Did that increase repair costs?
That's a great question. Yes, indeed, substantially. Specifically, I'm referring to Hurricane Sandy and those people who live close to the shoreline. Many seniors, a predominant number of seniors, lived on the shoreline and did not have insurance. So even making the repairs was just really very challenging for them. The City of New York came in and required that any home or dwelling that received substantial damage had to conform to new codes, and new codes were passed that the existing dwellings had to be raised 3 to 4 feet additionally from where they were. So we now have seniors who have owned their home for many years, cannot really make the repairs because if they do, they're required to pay the increased cost of raising them 3 to 4 feet for the future. So indeed, and that continues to be a problem that we're working with many of the homeowners here as we speak 13 months later or 14 months later after the game.
Excellent. Thank you. Are there any funds available to help health centers practice and prepare for emergencies?
We, at the Administration for Community Living, we only have funds that assist our states after a declaration of an emergency has been made and a disaster. But I would say that I think what we would really welcome from our HRSA partners is the opportunity to provide the training, to come in and do some training together jointly. I think that our community resources would also be available to do whatever could be done in terms of the local effort. But no, there's, with the budgets that we have in the federal government, I would say I'm not aware of any in the federal sector that is available for this type of training at the community health center level.
Okay. All right. Thank you. Are there shelter areas for older adults and people with special needs?
Yes, and this is done primarily through the response to the EF6 and EF8, which is usually shelters that are pulled together by local resources. So the feds really don't come in and provide those shelters. It's typically done through the American Red Cross by local authorities. Yes, indeed, they are for special populations, and that's another thing that Hurricane Sandy made us do, all of us on it for a national review, is to take a good look and see what is needed for people who are living in shelters who may have special needs. For example, beds, cots. Many times people can't utilize cots, and that's what we actually bring forward when we are setting up a shelter. So indeed, I think they do exist. They are really few and far between. They're highly designated, so you will see that there's a designation of a senior shelter in a particular area once we have a disaster. They're not commonplace. And the same with pets. Many of our senior population will not leave their home unless their pet can come, so they're also friendly resources as well, in addition to the special needs.
Wow, great, thank you. Are there any funds that can help seniors regarding ice and snow damage here in the Midwest?
Well, I would say anytime there's been a national disaster, a declaration by the President that a national disaster has occurred, contacting your AAA, your Area Agency on Aging, to see if there are funds available, federal funds, that can be applied for. In the state of New Hampshire, when we had a flood, it was called the Mother's Day flood, and it came on Mother's Day, and many people lost even some of their water heaters and things in the basement. Through the Administration for Community Living, who has funds that they provide to states, people could apply for those. And I would say always in the event of a disaster declaration, check with your AAA or your state unit on aging to see if federal funds are available to apply for renovations or to replace equipment for individual families or seniors.
Okay. Are there any special programs to prepare older adults who speak different languages for emergencies or disasters?
Well, just as we had with Hurricane Katrina, following Hurricane Sandy, and I think also Hurricane Irene, we've really put more of an emphasis on that. So on the websites that we have available, such as CDC and also even CMS, ASPR, which is another, is the Assistant Secretary's Administration for Preparedness. You can go onto those websites. They do have special brochures and training for various languages. I can't speak specifically to what languages are available, but I know there's been a concerted effort to make sure that there are various languages available in print and training.
Okay. What are the best ways to identify vulnerable older adult populations in my community?
That's a great question. I would say you could start with those things that you know. So you identify those people who are receiving services through the senior center. Perhaps it's a home-delivered meal, or maybe they're under your state waiver program, the Medicaid waiver. Almost every state has some kind of a waiver program that low-income seniors are eligible for and receive services. So those are the knowns. Those are the people in your community that you can identify. Some communities who have, say, for example, a nuclear power plant, they have lists of people who are considered at risk for evacuation. But those lists are hard to maintain, and typically they're not very current. So I don't know that's anything that you can count on. What I would recommend is that using your Aging and Disability Resource Center that's in your communities, talk with them. And if they don't have some type of a program where people either register or they have a list in the event they want to be contacted, maybe start something, because it really needs to be a grassroots effort so that you can find those people who live in the rural communities or those people who do not receive services.
And since you mentioned rural communities, are there any resources or specific tools out there to assist those, populations who are really far away and distant from your traditional medical facilities?
I would say yes, and they are informal. For example, those volunteers who deliver home-delivered meals to people who live in rural communities, they are a real asset, number one, because they provide the delivery of the meal, but also they know the people that they bring the meals to. So if you, in a healthcare center situation where you're trying to identify people in the rural areas, I don't know of any funds available for that, but I would say there is a resource available for training so that the volunteers who deliver the meals could be utilized for that opportunity as well.
And for logistic purposes, are there any recommendations for health centers to kind of stock up on a certain amount of resources or materials and some crucial items that they need at their disposal in the event of an emergency or disaster?
Well, that's a great question because it really underlies what I think is the foundation and the building block, which is just awareness or to have a conversation. So many of the resources that we have on the website and that you have on the PowerPoint and here before you on the screen, those give you things that you could print off, checklists. Also CDC and many of FEMA have already printed checklists and things that you can order, and receive. So I think having those available at your reception desk when people come in, making it a part of your assessment, so when they walk in the door, you can have on your assessment, do you have an emergency plan? Those types of things, I think, to bring the awareness and to utilize resources that currently exist. Funding, other than that, I am not aware of.
Okay. And are there emergency preparedness continuing education programs for community health workers provided by the AAAs?
Not that I am aware of. I believe that there would be continuing education probably through FEMA, so through your federal partners that deal with emergencies and disasters. But I think you would find in any community the Area Agency on Aging recognizes the need to make sure that all partners are identified and that people feel comfortable networking ahead of time. So I would truly encourage all of our community centers to reach out to the AAAs or the Aging and Disability Resource Centers, which may or may not be the same. They could be two separate individual providers. They're not necessarily the same, but reach out in your community and start something if it's not there.
Yeah, good. Does an emergency operation plan for older adults need to be approved by state health departments?
If a licensed facility, they would have to have an approved plan. Yes, indeed. Anyone who's on state assistance, such as a waiver program, as I mentioned, that is something that has to be approved. But if an individual, does not require any type of a plan that needs to be certified or reviewed by an entity.
Okay. And on average, how long would it take after a state of emergency is declared before you actually get the assistance, the funds, the boots on the ground?
That's a great question, and it could vary from disaster to disaster. The federal government will not come in until the governor has requested such. So it's really, we try to implement the process where the local government, when they feel as if they cannot handle the disaster, will contact the state government. The state government, when they feel they need additional resources, will contact the federal government. So it is a process that's clearly defined and understood by government. But getting, getting volunteers organized ahead of time, such as the example in Alabama, that's really helpful because that will help and bring immediate need to areas that, waiting for the National Guard and so forth to come in does take at least 24 hours many times unless it's available to them. But having something set up where you can readily utilize local resources would truly be, I think, very beneficial.
Yeah. I think, does a AAA have to have an approved emergency preparedness plan?
They are not a licensed entity, so what they do is they have practices and policies for making sure that they deliver services in the event of a disaster. An example that I would share with you is our recent situation in West Virginia. Many folks have read that we had a contamination. The AAAs in that area, and there are 9 that are in 9 counties that are involved in that particular situation. They have policies and procedures in the event of a disaster, how they get meals to people, how they're getting water to people. It's not a licensure and it's not a certification. It's a practice of policies and procedures as it relates to the AAAs for delivering services.
Okay, excellent. And when conducting outreach, are there some low literacy and culturally competent resources that health centers can use to educate older adults and those living with disabilities about emergency preparedness?
Yes, indeed. FEMA has done a great job with that. They actually are taking pictures and making PowerPoint presentations and checklists that have pictures versus words, so that in the event you have a challenging situation where you're not able to communicate, a picture speaks 1,000 words, and they're utilizing this as part of their checklist. If you cannot find it on the FEMA website, please feel free to let me know, and I can make an introduction to the FEMA contacts that we have at the regional offices so we can get that to you. But yes, they are there, and they're using pictures to help people understand what services are available.
And does the federal government or state governments, do they or can they designate health centers as areas that are first responders, or is there some type of formal designation health centers can receive, or is there a process to that?
I would say to you that that would be something on a local jurisdiction. Many times they do that, but I don't know. It would occur at the local level versus the federal level, so I really would know the process.
Okay. We still have we have a few more minutes for questions and answers. If you are interested in asking Kathleen something, please feel free to type your question in your box and we can get that answered for you. Currently, we don't have anything in the queue. Let's see. Okay. Okay. Well, once again, Kathleen, thank you for this excellent webinar. It was very informative, great information. I know each person has something to take back to their agency, their health center, to really start to improve and change some of our programs to respond to emergencies and disasters and keep older adults healthy and safe. Thank you so much, and like I said, the PowerPoint will be made available to all of the participants. Thank you.
Yes, thank you.
Bye.